Today we're going to be talking about pain between your shoulder blades, that nagging, achy, sometimes sharp pain, sometimes that constant tightness that we have in this area here. First, let's talk about why we have pain in that area. So pain in the back of the shoulder blades often has to do with where we're sitting in the front. If you look around at most everyone nowadays, we tend to have our shoulders rounded forward, kind of pulled down. Why do we have that? We tend to be Pec Dominant. So Pec Major comes across from the sternum, from the clavicle. That's inserting into the humerus, your arm bone there. So that's pulling your humerus forward. Basically taking that humerus, pulling it forward. Pec Minor is underneath that, kind of a stringier little muscle coming up from here at this diagonal, attaching right there to the front of the scapula. So that's pulling shoulder down a little bit. So Pec Major, pulling that humerus anterior, Pec Minor, pulling that shoulder blade down and forward. So a lot of pain between your shoulder blades in the back comes from front side and just being tight across the front of our body. We tend to be a very Pec Dominant culture. We sit kind of here, we're holding our phone here, everything's in front of us, and we use these muscles a lot more. We don't have our grandmothers, at least as often anymore, hitting us with rulers, telling us to stand up straight. Teachers aren't allowed to do that these days. So we just get very tight through that area. So Pec Major, it's coming across from the clavicle here, down the sternum. It's inserting into the humerus here. It's pulling your arm forward and pulling that humerus anterior in the joint. Pec Minor is a stringier little muscle. Underneath that, coming up at this diagonal, it's attaching right here to the front of the shoulder blade. It's pulling your shoulder blade down and forward. So we go from, shoulders being back here. Now our humerus is anterior a little bit, and then Pec Minor's tight. It's giving that forward rounded appearance through our shoulders, through the front. In the back, what that means is our shoulder blades are not sitting beautifully quite here. They're getting pulled around like that because the pecs are so tight on the front. These muscles coming between the spine and the scapula right there, the rhomboids, they're just yanked on. They get tight, overstretched. Kind of like people, when they're constantly overstretched, they want to curl up in a ball. Muscles, when you chronically tension them, they'll put protective knots and kind of contract their tissue to relieve some of that constant stress on them. And that's how we get those nasty knots through this area, trigger points and buildup of acidic tissue. So let's talk about what we can do when we have pain through this area. So the first step is going to be actually to open up the front of the body, stretch out your Pec Major, Pec Minor, so that your shoulders can sit back, so your scapula can come right back here instead of sitting way out there. So I'm going to show you some foam rolling exercises for that.